Greetings, folks. Today, another episode of Counselor Soapbox videos. This episode is over-the-counter drugs. There are two very important characteristics we need to consider when we select a medication. One is, are they a GRAS substance that is generally recognized as safe? Some products contain ingredients such as water that are very, very safe, but may not be that effective for helping with your particular issue. There are other products that are GRAE, generally recognized as effective, but their ingredients may not be that safe. For example, in history, people were treated for worms or parasites by being given compounds that were poisonous, such as arsenic. Yes, the arsenic killed the worms, but at too high doses could also kill the human. It's also possible to have a headache remedy, which consists almost entirely of water. If you're dehydrated, yes, it would be helpful, but otherwise it's not very helpful. But a bottle of water with a label saying it's a medicine would be a GRAS, a generally recognized as safe product. Most over-the-counter medications are mixtures of ingredients, and they need to be both safe and effective. Because over-the-counter products can be purchased in any drugstore or pharmacy, people assume that there's a lot of government regulation and oversight. The truth is that these products were not FDA regulated until 1962, and since that date, they have been studied by the ingredients, not by the brand name. So many of these products have combinations of ingredients. There are a few major types of over-the-counter drugs: pain relievers, also called analgesics, cold and allergy medications, stimulants, and sedatives. Pain relievers, known as analgesics, are one of the most commonly purchased over-the-counter medications. Aspirin is one of the oldest of these medications. All of these medications have their good qualities when used according to the instructions on the package. But when used incorrectly, there's potential risks from all of these. Aspirin, if used in higher doses than recommended, can increase the risk of bleeding and can irritate the stomach. It also can be used to thin blood and to treat heart conditions, although some of that research is now in question. Acetaminophen is a very effective pain reliever, often sold under the brand name Tylenol, but if taken at higher doses than recommended, it can be very harmful to the liver. Recently, average daily use of acetaminophen, the total dose that people should be taking, was reduced because too many people were taking too much. Ibuprofen and naproxen are also very effective medications for treating pain, but if taken incorrectly in too large a dose, they can be harmful to the kidneys. One of the difficulties with these over-the-counter medications for pain is that people take a few of the medication, a few pills, and 15-20 minutes later, they still are in pain, so they take more. These pain relievers need to go through the stomach, into the intestine, into the bloodstream, and circulate. So, by taking multiple doses close together, people can reach a dangerous level. If you take a dose of a pain reliever, give it time to work, and follow the instructions on the package before taking a second dose. Aspirin, acetylsalicylic acid, has been used since ancient times. Salicylic acid is found in willow bark and was used by Native Americans. It was used in ancient Greece and so on. However, too much aspirin or salicylic acid of any kind can upset the stomach. As an analgesic, it relieves pain without causing unconsciousness. And it is an antipyretic, which means it reduces fever, and anti-inflammatory, which means it also reduces swelling. While aspirin has its uses, it is not very effective in treating sharp pain or stomach pain, and there can be adverse effects: stomach irritation, excessive bleeding, Reye's syndrome in children who have the flu or chickenpox. It's an anticoagulant and prolongs bleeding and may prevent heart attacks or stroke because of its ability to thin blood and reduce blood clots. Acetaminophen, most commonly known by its brand name Tylenol, is a very useful medication when taken as prescribed. The pros are that it reduces pain and reduces fever and does not irritate the stomach, so it can be taken by people who have stomach issues. The cons or negatives of it is it's not an anti-inflammatory, so if there's swelling, it won't help to reduce this. It may cause liver problems, especially when taken by people who have damaged livers as a result of alcohol. Every year in the United States, about 56,000 overdoses occur as a result of taking too much acetaminophen. And from those, 500 deaths per year occur. Recently, the recommended maximum dosage was reduced. Other over-the-counter medications for pain include ibuprofen and naproxen. These are both analgesics. They are anti-inflammatory, though they have side effects if you take too much of stomach irritation or damage to the liver and the kidneys. Cold medications, which sometimes include medications taken for the flu, include a number of ingredients. Pseudoephedrine, which is a decongestant and very effective for that, but also became abused when it was used illegally for manufacturing methamphetamine. As a result, this is now kept behind the counter, and there are restrictions on people purchasing it. There are also a number of ingredients that are called expectorants that break up the phlegm and allow you to cough it up. Antitussive ingredients suppress coughing. These could include dextromethorphan. However, people are abusing this. Many teenagers have found that certain cough medicines contain dextromethorphan, when consumed in large amounts, can work somewhat like PCP and ketamine. And at those high doses, these can cause hallucinations. Also, some cold medicines may include alcohol. Antihistamines can also be found among the cold medications. They typically cause drowsiness. Many people underestimate how drowsy they will become when taking these and can put themselves into dangerous situations. Over-the-counter stimulants are extremely limited. Over time, most of the stimulants that were being sold over the counter have been regulated and removed from the market. Of those that remain, caffeine is the most common over-the-counter medication, and it's used as a stimulant. The danger comes when people take large amounts of caffeine pills with energy drinks or heavily caffeinated beverages. At that rate, they can reach an overdose, and they may show up in the hospital ER believing they're having a heart attack because of the amount of caffeine in their system. This is especially dangerous when caffeine is mixed with alcohol. There are other antihistamines which can be used as sedatives, and when used as the label dictates, are relatively safe. But again, people will abuse them and take too much. Some of the side effects of these antihistamines are dry mouth, and of course in excessive quantities, the drowsiness can cause risky situations. Thanks for watching another Counselor Soapbox video. What's ahead? More drug education videos, many about specific drugs. Also, some mental health and wellness videos. If you've enjoyed this video, please click the like button, which is directly below this. Comments are always appreciated. And to receive new videos in this series, please subscribe to the Counselor Soapbox video channel. Thanks for watching the Counselor Soapbox video channel. For more information on this and related issues, please visit the Counselorssoapbox.com blog, where you'll find over 1,500 texts, articles on mental health, substance abuse, and having a happy life. The David Joel Miller fiction and nonfiction books are now available on a wide variety of ebook sellers platforms. The photos here are all courtesy of Pixabay and Wikimedia and are licensed under the CC0 Creative Commons free for commercial use, no attribution required license. Thanks again for watching.